for all of the kind of behind the scenes work, working with our administration and community development leadership to create
to May 22nd 2-week interval, to 1.9% May 23rd to June 5th, and then to 15% June 6th to June 19th, which is our most recent fairly complete snapshot. Now, looking at emerging data for the next 2-week period, which is June 20th to June 3rd, which of course is incredibly preliminary, that early data is pointing to another substantial increase, likely more than double the 15% we saw in June. Now, as we move forward, knowing that about the variant and how we sequence, I want to summarize 3 key things that I think we all need to know about the Delta variant as it's moving in to the state of Ohio. First, Delta is highly contagious, and it spreads exponentially fast almost anywhere it has gone. Estimates are that it's about 50% more contagious than Alpha, or the B.1.1.7 so-called UK variant, which itself was 50% more contagious than the variant which caused our winter surge. As a result, the Delta variant is moving rapidly to replace B.1.1.7 or the Alpha variant as our dominant form of COVID-19. Secondly, Delta is a real threat to the unvaccinated, or those who are not yet fully vaccinated. According to the CDC, current data suggests that 99.5% of COVID-19 in the United States has occurred among unvaccinated people. And experience in the UK also suggests that those who are younger than 50 may now be more than twice as likely to be infected. And this actually makes a lot of sense when you consider the very high vaccination rates among those older than 50 that are present both in the UK and here in Ohio. And according to a recent Lancet study, Delta is much more likely to cause someone to be hospitalized if they're unvaccinated than the Alpha variant was. So the reality is we now have 2 Ohios, an Ohio that is vaccinated and protected on the one hand, and an Ohio that is unvaccinated and vulnerable to Delta on the other. Looking at places like Missouri, which have been dealing with high rates of the Delta variant, it appears that communities with low vaccination rates are at particular risk of what have been called hyperlocal outbreaks, concentrating the devastating impact of this disease in those communities. And lastly, vaccination remains our best defense, and in fact offers excellent protection. All 3 of the vaccines offer very high rates of protection against Delta hospitalization and death. And while yes, there are potential side effects from vaccination, just like there are from any antibiotic or any medication, those risks are small indeed compared with the risks of COVID-19 for people of any age. Now, joining me today is Dr. Andy Thomas, Chief Clinical Officer of the Ohio State University Wexner Medical Center. And Dr. Thomas, I'd like to turn to you because we're hearing reports that the Delta variant is more contagious and perhaps more severe. What are you seeing in your hospitals? And are you seeing that hospitalization is happening more among the unvaccinated?
Good morning, Dr. Vanderhoff, and thank you very much for having me here this morning and representing the zone leads on the call this morning. So first of all, I agree with everything you've just gone through in terms of your summary of the Delta variant, the importance of vaccination, and the potential impact of the Delta variant on those who aren't vaccinated. I think the key message that I describe to my patients and to individuals and groups that I speak with is the way the virus is transmitted from my mouth or my nose to your mouth or your nose is still the same as it was before. But what the Delta variant, the difference for the Delta variant is it takes less of the virus going from my mouth or my nose to yours to potentially infect you. So the route of transmission of the virus is the same. So it's the same things we've been talking about that have protected people all along with either distancing or masking. For those that are unvaccinated, there are some things they can do to reduce their risk, especially for those groups of individuals who aren't eligible to be vaccinated, i.e. those that are under age 12. But I think your point's a really good one, that the power of vaccination and what we've been seeing here in the Central Ohio hospitals over the last couple of months. We don't have the full June data yet, but since April, really at a time when a large percentage of the adult population was able to be vaccinated, about 90% of the hospital admissions here in the Central Ohio area have been those that are either partially or unvaccinated. And only about 10% of those hospital admissions with active COVID have been in vaccinated groups. But many of those patients have other medical conditions like active cancer treatment or been a transplant patient or other immune issues that still, I'm sure they're more protected than they would have been if they hadn't been vaccinated. And there are many people in those patient categories that are vaccinated that aren't in the hospital, even if they get COVID. But it's clear, just like the national data that's showing, really 1% of the mortalities from COVID nationally now are in vaccinated patients. 99% are in those that are either partially or unvaccinated. I think that the Delta variant just makes the case even more clear for the importance of vaccination to reduce your risk of getting a more contagious virus. And to some degree with the Delta variant, this is to be expected. This is the same thing that you and I and others were talking about with some of the folks on the call today in the press back in February and March, looking at the UK variant that was more contagious, out-competing other versions of the virus. And by late April, early May, we had really the UK variant becoming the predominant variant in the state of Ohio. We're seeing the same with the Delta variant now, where we're seeing this doubling time over each 2-week period to the point that it will eventually become the predominant variant in the state. So I think in terms of hospitalization, which was one of your questions, we are seeing a slight rise over the past 7 days. I think some of that rise is most likely a small bump in cases coming out of the July 4th holiday that we're now seeing those cases become hospitalizations. But I think the reality is we've gone in our zone, zone 2, which is about a third of the state, from the high 40s of patients in the hospital the last week of June, first week of July, to the mid 60s of patients in the hospital. Now compare that to 1,200 patients in the hospital on our worst day back in December. So the numbers we're at now are where we were in about mid-June. They aren't unprecedented by any means, but they are on the rise. And what we don't know, as we've talked about with the press multiple times over the course of this pandemic, we hope that rise will peak and come down, but we don't know that yet. And that's why we're certainly tracking those numbers on a daily basis and making sure that we're following the data and responding as best we can to be prepared for any surge of patients.
Thank you very much. We're also hearing a variety of reports nationally about various trends that are impacting hospitals and health systems in different parts of the country. What else would you say about what our hospitals and health systems are observing about COVID-19 activity in Ohio relevant to the stories we're hearing nationally?
Well, I think many of them are consistent. I think part of the good news of the vaccination stories, if you look at those that are most vulnerable and highest risk in our state, even though we're sitting just under 50% total for vaccinations of our population, if you take out those under age 20 from both the numerator and the denominator, we're sitting closer to 60% of individuals that are vaccinated. That's a very, I think, good number compared to many, many other states around the country. But if you look at those over age 60, we're well over 70%. And those over age 65, we're over 80% of those patients being vaccinated. So when we think back to the November, December timeframe, and even into January, before we had vaccine widely available to the general public, we were seeing large numbers of elderly patients being admitted to the hospital when they contracted COVID. Luckily, our treatments were different than they were in the spring of 2020. We had new medications, new ways to deliver oxygen, and our outcomes have been better, even during the peak of the virus, than they were at the spring of 2020. But I think what we're seeing now is, with a lot of older patients fully protected by being vaccinated, we're seeing fewer of them being in the hospital, which is great news. Even if they are contracting COVID, if they're vaccinated, they're less likely to need to be admitted. So I think the trends we're seeing are relatively similar to other trends nationally. But certainly, to your point earlier, there are some hotspots in certain states around the country where there are high percentages of unvaccinated patients. And I think we need to keep an eye on that in Ohio as well, since there are some parts of our state that have higher percentage rates of vaccination than others. But my hope would be those individuals at high risk will have taken this seriously, will have taken the opportunity to roll up their sleeves and protect themselves and their loved ones to reduce that risk of hospitalization, being in the ICU, or unfortunately passing away from the virus.
Well, thank you very much, Dr. Thomas. So in short, the good news is that our current vaccines are effective against the Delta variant. The bad news is that if you're not fully vaccinated, you're at real risk of contracting the Delta variant, including real risk for serious illness, including hospitalization and death. Remember, COVID-19 is now a vaccine preventable illness, and not being fully vaccinated puts you at risk. The best thing any of us can do to protect ourselves and those around us is to choose to be vaccinated. Bottom line is, when there are more people who are vaccinated, there are fewer people who can carry this virus, and therefore more of us enjoy the protection. Time also is of the essence. Remember that if you get a 2-dose vaccine, it can take 5 to 6 weeks for you to be fully protected. Your first dose, followed by your second dose 3 to 4 weeks later, and then full protection a couple of weeks after that. With fall and cooler weather approaching, we need to prepare, and we need to protect ourselves now. The COVID-19 vaccines are thankfully widely available and accessible, and there's really no need to wait. If you're not yet vaccinated, we ask that people please consider getting vaccinated, and if they aren't going to be vaccinated, please wear a mask and practice social distancing as much as possible. Alicia, I think we can now take questions.
Thank you, Dr. Vanderhoff. Our first question comes from Chelsea Sick with WKEF.
Hi, Dr. Vanderhoff. Thanks for taking my question. So we were told the state does not track the number of breakthrough hospitalizations or deaths that come specifically from the Delta variant. So how do health officials know the efficacy rate of the existing COVID-19 vaccines in fighting that variant?
Sure, that's a really, really good question. And let me break it down in a number of ways. One, perhaps the most important way that we monitor efficacy are through published studies that are designed to give us an understanding of how well the vaccine is working. And those are iterative. They come in, over time. And we've had recent published studies that have looked at the Pfizer vaccine and the Johnson & Johnson vaccine, both of which have been very, very encouraging. There's an ongoing study right now with Moderna, but since it is essentially the same thing as the Pfizer vaccine, I think most in the medical and scientific community, really ascribe whatever is seen with Pfizer to Moderna. It certainly played out that way over time. There's a second mechanism, though, and that is that the FDA and the CDC together do ongoing concurrent monitoring of the vaccines. And a part of that concurrent monitoring, of course, also involves the efficacy of the vaccines. And then the final piece of that is we can look at overall vaccine breakthrough rates. As you know, our vaccine breakthrough rates in terms of breakthrough hospitalizations, breakthrough deaths have been vanishingly low. And that has continued on a national basis, even now when nationally Delta is the dominant virus. And here in Ohio, where it is emerging as the dominant virus. So those patterns together, those three sources of information give us, I think, a very high degree of confidence that this vaccine, this set of vaccines that we have and the Delta variant are a good combination. But it's certainly something we pay a lot of attention to. Dr. Thomas, is there anything I missed that you would add?
I agree completely. Nothing to add. Thank you, Bruce.
Our next question comes from Lindsay Mills with WBNS 10 TV.
Hi, good morning. My question is actually for Dr. Thomas. I'm curious to know, we talked about the trends, how they compare nationally and here, but with hospitalizations here in Ohio on the rise, are the effects of the Delta variant worse? What are you seeing from those recent hospitalizations? Does the Delta variant affect patients differently?
Thanks for the question. I think similar to Bruce's response, much of the data that we look at is data that's presented on a national basis from research scientists, the CDC, and others. At this point, I think we probably don't have a large enough N of patients yet that have been hospitalized with the Delta virus to really make any sort of a statistically significant assessment of just our patients here. But I think in general, the good news is that we aren't seeing a huge spike in hospitalizations, even though we're seeing this increase over the last really month, as Dr. Vanderhoff described, in the percentage of cases in the state that are the Delta variant. We're not seeing a doubling or tripling of hospitalizations. So I think the good news is that if you are vaccinated, you should be protected, at least against getting seriously ill or needing to be in the hospital. I think what's unclear is if you're not vaccinated, it's certainly easier to catch. That we know. We've described how it's more contagious. And I think that the reality is, even if it is not more virulent or causing more serious illness, the more likely you are to have it. Even if it's a small percentage chance that you're going to be in the hospital, the more people have it, the more people are going to be in the hospital. So I think that the studies are not showing that it's incredibly more virulent, or more serious as an infection. But what I will say, if you're not vaccinated, on average, compared to someone that is vaccinated, it's significantly higher risk to need to be in the hospital or to get severely ill. So I think it just gets back to the best way to protect you is to, one, not get the virus. But even if you come into contact with someone who has the virus, the best way to protect yourself is to be vaccinated.
Thank you, Dr. Thomas. Our next question comes from Courtney Wheaton with WKRC.
Hello. I was just wondering, with the Delta variant on the rise, a lot of camps and, we have a lot of concerts going on right now. And I read a couple of articles from Wexner saying that they could be super spreaders for these events. So should we stop doing these events? Should the people that are organizing them change their course of action with this on the rise?
Well, I think that the recommendations and cautions that we've been offering all along really continue to be important for people to remember. Of course, the best thing that you can do, and as Dr. Thomas shared, among those who are 18 and older, the majority of people have chosen this path, which is get vaccinated. And so the very first thing that I think Dr. Thomas and I would ask is that people who aren't vaccinated think about the benefits to themselves personally, as well as those to other people getting vaccinated. But the other recommendation that we've continued to offer is if you're unvaccinated and you're going into a crowded environment, we still recommend that you mask. Masking is a good step. We know that masking works. It helps reduce the ability of me to project virus to you or vice versa. And so we would encourage people who are not masked and going into crowded environments to wear a mask. The third thing that I'd point out is that this variant, it does not spread well out of doors, just like the variants that have preceded it. So fortunately, many of our concerts and gatherings this time of year are out of doors, and that's something that does give us as health providers and health officials a level of confidence about what's happening. But we want to remind people the basics still matter, and masking and trying to maintain distance is still prudent and advisable if you're unvaccinated.
Yeah, Bruce, I think the only thing I might add is I think you're right in that distinction of if you're not vaccinated and you're going to one of those types of events, you really should mask. And even though you're exactly correct that outdoors, the risk of spread is far less than indoors, at an outdoor event where you cannot control your environment. So think about some concerts you go to where there are people standing in really close proximity to each other. That pretty much approximates being inside. If you're in an event where there's a good spread because the people are on a blanket, or you're going for a walk in the neighborhood with your neighbor, those aren't the risks we're talking about. We're talking about outdoor risk where you can't control your environment. People are in very close proximity to you. If you are unvaccinated, that's not a very safe environment, especially if you're not masked. But I think for those that are vaccinated, I think there's a lot of evidence that they're pretty well protected in those sorts of environments.
Thank you, doctors. Our next question comes from Danny Eldridge with Hannah News.
Hello, Dr. Vanderhoff and Dr. Thomas. So school is set to start in about a month or so in many parts of the state, and children under 12 cannot get vaccinated. And it looks like a lot of schools are not going to require social distancing and masking unless the state tells them to. So what is the state planning to make sure children are safe when they go back to school?
Well, we are following right along with the CDC in recommending that people continue to apply the basics that we know worked, because they worked in the previous school year, which was a time before we had any vaccination which was available. And that simply is that if you are not vaccinated or able to be vaccinated, the safest bet is for you to mask and maximize distance. And we were very successful with that here in Ohio in our schools this past winter. So I think that the good experience is there for us to learn from, and we are continuing to encourage that people apply those lessons from our recent past.
Thank you, Dr. Vanderhoff. Our next question comes from Jim Province with The Blade. Jim?
Good morning. This is for Dr. Vanderhoff. Are we still talking about a vaccination disconnect largely with the rural areas of the state where the low vaccination rates are most prevalent? Or is there still a disconnect that we're seeing between different demographics in Ohio?
Well, what I would say is that we have a vaccine hesitancies exists really in pockets all across our state. As I look at the vaccine data and the vaccine data that we publish and break that down by county, it is clear that some of our highest vaccination rates are in our metro areas and the immediate suburbs of those metro areas. In some ways, that's reassuring because that's where we have the greatest concentration of people. But it does concern me and other healthcare leaders when we look and we see that we have communities all across the state who still have relatively low vaccination rates. And many of those are our rural communities. The lesson, I think, comes to us from Missouri, where Missouri is seeing a very severe outbreak of COVID-19 driven by the Delta variant and disproportionately impacting communities with low vaccination rates. So yes, it is true that many of our counties with the lowest vaccination rates are more rural than urban. It is nevertheless the case that even in our greater metro areas, we have pockets where there are areas of low vaccination. So that hence our message. This is still the right time to get vaccinated, and we would strongly encourage those who are waiting to not wait anymore.
Yeah, Bruce, I think the only thing I would add beyond some of the geographic differences that you mentioned is we've known really from the beginning that the interest of a 20, 30, or 40-something-year-old to get vaccinated is just going to be on average less than those over 60, over 65. As I described before, those at highest risk have in many ways also been since the beginning of the pandemic more isolated and less active in our communities for that same reason. So I think we've been working hard, whether it's through local churches, whether it's through local employers, whether it's just through the media, to try and make sure that we encourage those that are in the 20, 30, and 40-year-old age groups to really take advantage of the opportunity to be vaccinated, no matter what community they live in. So it's not just geographic differences. There are still some age-based differences in vaccination rates, as I went through before. We have a very high percentage of those over 60, over 65 that are vaccinated. I think that's terrific from my perspective as a hospital leader, from my perspective as someone who's working with the state on trying to make sure we keep this pandemic under control. It really is going to take those in that 20, 30, and 40-year-old age group to have a higher vaccination rate, because even though they may not be at risk of being in the hospital, if they're around people that are, and that, the more likely that virus bumps up against someone who's vaccinated, it's like hitting the brick wall, as opposed to bumping up against someone who's not vaccinated. It's like Velcro. And it's more like Velcro than it was before with this variant. So those folks that are in that 20 and 30 and 40 age group really can do their part by rolling up their sleeve and getting vaccinated to try and make sure we can keep this under control for the entire state, even though there may be a little bit less personal interest in this, because for them it might be a less of a risk of actually catching the virus, or I should say less of risk of getting seriously ill if they catch the virus. It's really in the interest of our communities and our state if all of those people take the opportunity to get vaccinated.
Yeah, and I think I'd add to that we have to remember that that younger Ohioans are still at risk from this virus. The good news is this is a vaccine preventable illness. They have an opportunity to really protect themselves from something that they need not suffer. And that younger Ohioans, in fact, do develop multi-system inflammatory syndrome, which is very bad. It causes inflammation of organs throughout the body. And we see that largely in younger people. They can also become long haulers. And let's not forget, while very small in number, nevertheless, we see young people with no apparent particular risk factors end up hospitalized. And these are all avoidable. So, in an era where we can prevent something with a vaccine, it's a shame to see any younger Ohioan get sick when they need not have gotten sick.
Thank you both. Our next question comes from John Reed with Gongwer.
Good morning, doctors. With Delta being more infectious, more easily transmitted, what's the risk of someone who is vaccinated not being asymptomatic and transmitting this to someone who's not vaccinated?
Well, I think there's a good news story there as well. Of course, most vaccinated people won't even become sick with COVID-19, whether from Delta or any other variant. But we do know that there are instances where vaccinated people, as is true with any vaccine, can develop some mild illness. But here's the good news. The recent emerging research, and I believe the CDC director commented on this recently, the recent emerging research really tells us that the viral load that we're measuring in those people is really not very high, which means that we don't believe they're generating enough of a viral load to really be very contagious. Moreover, when we're looking at a population level, it doesn't appear that vaccinated people are the people who are spreading this variant and this virus, all of which points to one more favorable indicator about the vaccine. Even if you develop mild illness, it appears you're far less likely as a vaccinated person to transmit the virus than obviously someone who's not been vaccinated. Dr. Thomas, have you been seeing anything else that you'd add?
I have nothing else to add. I agree with what you said completely.
Our next question comes from Anna Huntsman with IdeaStream.
Good morning. So we've been talking about, low pockets across the state where or in other states, there are pockets where there seems to be a lot of spread driven by Delta. We've also talked about some counties in Ohio appear to have low vaccination rates, and that could be a concern. So I'm curious what you can share about what we're seeing with those upticks that you were talking about in cases and spread, and if those are in certain regions. Obviously, we don't have the public health advisory anymore to kind of look at that for ourselves. So I'm curious what you can share about where we're seeing some of this spread happening regionally in the state, and if that seems to be driven by low vaccination rates.
Well, fortunately, and you can tell from the numbers I shared at the beginning, these are still very low numbers. It's simply concerning to us that after a long period of watching the numbers decline, we have seen them not only level off for a few days, but actually begin an upturn. But it's not, we just simply don't have enough numbers yet of positivity or of hospitalizations that it's enough to point to any kind of regional or highly specific trend. So this is really us, I think, providing an early warning in the context of what we're seeing nationally, where there are other parts of the country that are seeing a very significant upturn. Ohio sits in a region of the country that has been slower to see the advent of Delta. So I think that we have the benefit of watching other regions of the country and have a forewarning of what is likely to occur. Now that we're seeing this very early uptick, it's all the more reason for us to be aware of what Delta has done elsewhere and likely how it will behave here in Ohio, which is it will move rapidly through the unvaccinated population.
Yeah, Bruce, I think the only thing I would add, even though the color-coded map is no longer being produced, the state still does produce the county-specific data over a prior 2-week period for cases per 100,000 individuals. And if you looked at the last data, which was through last Wednesday, the state was, I think you referenced this earlier, Bruce, was at about 19 cases per 100,000 individuals. If you look across our 88 counties, that ranges from a high of 85 cases per 100,000 people in our highest county, which was Clinton County, down to a number of counties that are under 10 cases per 100,000 over the past 2 weeks. So there is a variation, but I think it's to Bruce's point, I think it's a little too early to say that we have a significantly major difference between our regions of the state. But I think if we, much like we used to talk about with China, Italy, New York, we see what's happening in other states. We see the trends that are happening in other countries related to these pockets of unvaccinated individuals. And I think really part of why I think we're here today is to just reinforce with those in our state that have so far chosen not to get vaccinated, that really they need to rethink their approach, and that as this variant comes and is more contagious, whether you live in a rural or an urban area, you're at risk.
Thank you both. Our next question comes from Brian Hamrick with WLWT.
Yeah, I appreciate you guys taking the time out in the question here. Very quickly, two things. How do we know whether the rise that we're seeing here is from a surge because of activities of July 4th or the Delta variant? Can you separate that out at all? That's the first thing. The other question I have is, with half the people vaccinated, what is the risk? What is the potential for a new variant that is not yet out and is maybe more dangerous, more resistant to the vaccines? And is that concern on the radar?
Yeah, so I'll start by hitting both those and then turn it to Dr. Thomas. As we have said, it's really too early for us to be able to say definitively that the uptick that we're seeing now is the direct result of Delta or the direct result of a post-holiday bump, et cetera. It could be both. It could be that plus other things. But what we can say is this: look, context matters. And as we are looking around the world and around the country, we're seeing that where Delta has gone, Delta has driven significant upticks. And we know two things for sure. One, Delta is here and it is rising rapidly. We know that from that genomic testing information that I shared before. Secondly, we know that we're seeing, after a long period of continuous decline, now several days of an uptick. When we put those pieces together, it sure makes one think Delta might be at play here, that we might be seeing the beginning of Delta's impact on the state of Ohio. Secondly, we're constantly monitoring for other variants. And, for example, Dr. Thomas and I were talking just yesterday about reports in some of the national literature about emerging variants from other parts of the world. There's a Lambda variant that's been reported on down in South America. It's the one among many variants of interest. And if you look at the CDC site, you'll see that they list a number of variants of interest. There are others. And people like me and Dr. Thomas watch those very, very closely. However, I'd say at this stage in the game, it's very premature to make any conclusions about any of those. But we have some good track record, some good news that we can look at as the variants have hit the United States, and they have been experienced by people here in this country. Our vaccines have held up extremely well. And so as that happens over and over again, now happening with the Delta variant, it really does create a greater sense of confidence for us about the quality of the vaccines that we have, which I think are very, very good. Dr. Thomas, would you add anything?
I agree 100%, Bruce, with what you shared.
Thank you. Our next question is from Jess Harden with Mahoning Matters. Jess?
Hi, thanks so much for taking our questions today. Obviously, you've outlined the dangers of the Delta variant to the unvaccinated, but are you recommending any changes in behavior for vaccinated people, given that there have been breakthrough cases and that vaccines obviously aren't 100% effective, and especially in terms of summer travel and other things like that?
Yeah, I think that the good news is that the vaccines have really proven to be incredibly protective for people. And my recommendation would align with that of the CDC. If you're a vaccinated individual and you're now fully vaccinated, unless your personal physician has advised you otherwise due to the specifics of your medical condition, which may be perhaps an underlying immune problem that you're known to have. But for most people, vaccination is outstanding protection. And I think we remain very confident that if you're vaccinated, you can really pretty much go about business as usual. However, if you're unvaccinated, what we're saying is, look, the risk just keeps getting greater and greater. And Delta is the latest variant on the block. Others will come. Mask, maintain distance. Those are really important steps. But please think about getting vaccinated because it's your best protection.
Thank you. Our next question comes from Gil McClanahan with WCHS.
There we go. Hope you can hear me now. My question is, listening here to your concerns about the increased numbers of the Delta variant, will that make it necessary for you guys to go to the governor and say, hey, look, recommend to him that maybe we need to bring back some of the COVID restrictions that we had from a few months ago? And if the numbers continue to go up, is that a possibility in the future?
Well, I'll tell you, it's really hard to speculate about where things could go or might go. And I've learned with this virus never to try to make predictions about its behavior, but I think we're in a very different position than we were in as we were heading into last fall, because we had no vaccine available as we were heading into last fall, and now, as Dr. Thomas shared, when we look at those 18 and older, almost 60% of Ohioans have begun the vaccination process, and when we look at those 65 and older, the numbers are better than 80%. So we have a lot of good protection there. I think really what our plea is now is that as doctors, we worry a lot about the 40% or the 50% if you look at everyone in the state who aren't covered. And we're asking that people who are not yet vaccinated take advantage of the benefits of this vaccine and protect themselves and others with vaccination. And that we remember that there's some folks 12 and under who can't get vaccinated right now. And we need to think about how we best protect them, because COVID-19 does affect people less than 12. And all we have to do is look at the cases of MISC, the multi-system inflammatory syndrome in children, to know that look at the cases of MISC, the multi-system inflammatory syndrome in children, to know that they're not immune from the bad effects of COVID-19.
Thank you.
Our next question is from Jim Oddie with WHIO.
Both doctors, hey, good morning. I want to have both doctors address very directly the pushback from the anti-vaccine crowd. These people have been very outspoken here at the State House repeatedly. Most recently on social media, you may have seen the stories. They've been out for a couple of months. They've come back again this week saying more people have died from the vaccine than from the coronavirus. I want to have you address that and other claims that have come about recently. What do you think, Doctor?
Well, thank you for asking that question, because I think it's a really important one. First, let me say that I understand completely hesitation about something new, whether it's a medication or a vaccine. And I think it is a wise and prudent thing for any individual or any parent to be thinking about the risks and benefits of a new medication or a new vaccination. That's good. That's wise. That's how we ought to be thinking through things. However, I don't think it is appropriate to make decisions on the basis of bad information. I think we need to look for sources of good information, reliable information. And the reliable sources of data that have proven themselves over many, many decades, the peer-reviewed medical literature, the scientific research, which is promulgated by the CDC and that is reviewed by the Advisory Committee on Immunization Practices, these have been very, very clear. The risks of COVID-19 vastly outweigh any risks associated with our vaccines. The benefits of the vaccines are far greater than the risks of side effects and problems from the vaccines. And one of the things that is extremely clear is that COVID-19 has ended the lives of far, far, far too many people, huge numbers of people, and that we simply don't see that happening from the vaccines. Could there have been vaccine-associated deaths? We believe that perhaps there have been some, but we're likely talking about a handful of cases. And that's going to be true of any medication, of any vaccine, of any intervention. The medicines that we provide our patients, the vaccines we provide our patients, are not entirely risk-free. They all carry risks, but their risks are tiny compared to the benefits that we offer. And that's why we as doctors offer them. The simple truth is the risks of these vaccines are tiny. The risks of COVID-19 are vast. Dr. Thomas, what would you add?
Bruce, I agree with your comments. I think, Jim, I would put the concerns into two different buckets. I think those who express concerns about the vaccine having a chip that tracks their whereabouts or that magnetizes them, I think those are disinformation, which is beyond unfortunate. It's disturbing. The other side of the equation is what Bruce was just describing, which is this is a new medication, and for the most part, just like anything new, we expect some people to have questions. And I think what we tried to do through the scientific means of study is to show what the actual rates of risks are, either for the virus or the vaccine. If you look at two of the more recent complications from the vaccine that have been described in the literature, myocarditis, which we've known for many, many months you could get from the virus itself. And now there's been shown some cases from the vaccine. If you look at those relative rates, it was around 1 in 50,000 individuals who got the vaccine got myocarditis, was the estimate from the CDC. If you look at the risk of getting myocarditis from the virus, it's probably 1,000-fold higher, more like 1 in 50 or even potentially higher than that compared to 1 in 50,000. The one that came out, I believe, was over the weekend or just maybe it was Monday, around the J&J vaccine and the risk of what's called Guillain-Barré syndrome. They identified 100 cases nationally out of over 10 million, well over 10 million doses of vaccine given. When you look at it, it was interesting that the news story I was listening to reporting on it, the last sentence was, and the rate didn't differ that much compared to people who didn't get the vaccine. Because you can get Guillain-Barré syndrome from getting bronchitis, from getting a sinus infection, from getting anything. Any sort of infectious illness can cause a very low risk of a serious complication. So I think that I would put the hesitancy really, like I said, into those two buckets. The first bucket, where it's just disinformation. It's clearly things that are irresponsibly being put out there by individuals where there's really no basis in fact. The second group, where there's hesitancy around some of these potential complications from the vaccine, those are being studied. They're being tracked incredibly well by the CDC in terms of the risks. And I think when you compare those risks to the risk from the virus itself, there's no doubt in my mind, as Dr. Vanderhoff has described, that the vaccine is far safer than walking around unvaccinated. And once again, the Delta variant just raises that risk for the unvaccinated as we move forward.
Our next question is from Kimberly Keegi with WSAZ.
Hi, everyone. Good morning. Thank you so much for taking our questions this morning. I do have a couple of questions regarding some specific numbers that I hope you guys can share with us. So the first one is, how many total number of cases in Ohio have been tied to the Delta variant? And then my kind of follow-up question to that is, can you give us an exact number of those who have a case tied to the Delta variant, a number of people who were vaccinated, and then versus the number of people who were unvaccinated, who had a case tied to the Delta variant? Thank you.
Yeah, I'm sorry, I can't give you those numbers. I don't have them immediately in my head. We can certainly share information about the number of tests that have been sequenced and have shown the Delta variant. We don't have any information that I'm aware of that would make the kind of specific ties, though, to a specific breakthrough case and a particular variant related to that breakthrough case. Remember, our breakthrough cases are vanishingly small. So the odds of being able to make such a correlation are very, very low indeed.
Bruce, for those who got on a little late, you might go quickly back through that description of the difference between the PCR testing and genomic sequencing and why we don't know exactly every case.
Oh, sure. So without repeating everything that I said, essentially what happens is that genomic sequencing happens after we have run a PCR test. It can only be done on a specimen that was drawn for PCR testing. Once we know that we have a positive PCR test, that's one that can be considered for genomic sequencing. And then only a subset of those can be, because either the specimen didn't have enough quantity or the viral load in that positive test wasn't high enough for the genomic sequencing to work. Then when we run that through, genomic sequencing, the time between beginning that process and actually having a formal, defined, and finalized result can be a matter of weeks. So we view genomic sequencing more as a surveillance, a public health surveillance tool, rather than a patient decision-making tool. Because if we waited that amount of time, it's just too late. When we're making clinical decisions, we have to make them immediately. And we've, by that point, either been successful in our treatment or not.
I think along those lines, Bruce, you're exactly right. Whether we're treating that particular patient, it doesn't really come into question whether it's Delta variant or not. We treat the patients the same way. And I think similarly, if you are unvaccinated and have been exposed at close contact with a patient with the virus, it's not like you should wait and find out if it's a variant on whether you need to quarantine or not. If you've been asked to quarantine because you're unvaccinated and had either a household or very close exposure, you need to quarantine regardless of what variant it may or may not turn out to be, if we can even determine that, because it's far after the process that you would have that answer, even if the answer was possible to find out.
The best source of information that would be scientifically reliable for answering the question that you're asking, very good question, has come out of two recent publications out of The Lancet. So I'd encourage you to take a look at The Lancet from the past month or so, and you'll see there are two very good studies that I think really get at your question and allow us to feel fairly confident that not only is our current vaccines very effective, but also that some of the conclusions we're drawing about this variant and its impact on populations have some scientific basis.
You both. Our next question is from Karen Kassler with Ohio Public Radio and Television. Karen, I see you're unmuted, but I can't hear you. Okay, we'll come back to Karen next. Unless, Karen, we can hear you now. Okay. Alexis Moberger with WSYX.
It was kind of stated earlier, but just to kind of ask it a little bit again, as far as with the variants, we're seeing the Delta variant, but any concern with this Lambda variant that we're starting to hear about?
Yeah, so Lambda is one of the variants of interest that we alluded to before. And at this stage in the game, I think that we ought to continue to have interest in what it's doing and know that the CDC and medical leaders are watching it, along with a variety of other variants of interest, very, very closely. The problem with drawing much in the way of conclusions about that particular variant is that while it has caused a lot of illness and has caused rapid spread down in South America, its impact has been geographically very circumscribed, and the population has a very, very low rate of vaccination. So it's hard to draw too much in the way of conclusions about that at this time, but rest assured it's among the variants of interest that all of us are watching closely.
Thank you. Our question from Karen Kassler came through in the chat, and that question is, has anyone at ODH talked to the governor about the bill that has a provision that would ban public hospitals and universities from mandating COVID vaccines?
Well, certainly I'm aware of that provision, and I think I understand, I recognize some of the concern for, why that found itself into legislation, that language. And I think that we can reiterate that there is not, nor has there ever been, an intention on the part of the department to mandate vaccination. We've never taken the stance that people would be compelled to be vaccinated. I think our message is, and has been, and will continue to be, look, vaccination offers incredible benefits. It is, from a public health perspective, from a personal health perspective, unquestionably one's best option in the face of a highly contagious virus that just continues to be more contagious over time. So I think that's it in a nutshell.
Thank you. Our next question is from Josh Rotenberg with Spectrum News.
Thank you for taking our questions. I'm going to go back to the pushback from the anti-vaccine crowd. This has been going on for close to a year and a half, this pandemic, and a number of people in Ohio did not want to wear masks. They certainly do not want to get vaccinated. But for those people, how long should you recommend that they be told to wear masks, even though it's likely they won't wear them at all? And do you believe that they will actually get vaccinated after this message today?
Well, as physicians and as public health leaders, it's our duty, our obligation to offer people the best information possible and to provide the best advice possible. First, the best advice to anyone who's unvaccinated is get vaccinated. And then, if you're not going to, mask and maintain distance. And we're going to continue to push that message. If even one person makes the decision to protect themselves and others through vaccination, we have been successful. And we're going to continue as a medical community, I'm sure, to continue to push this message with our patients in our offices and in public settings like this. This is the right message. This is the responsible thing for us as doctors to be telling the people of Ohio.
I agree with Bruce 100%. I think whether it's an individual healthcare provider in the office with the door closed, talking to a patient one-on-one, people talking to community groups, or people like Dr. Vanderhoff and I speaking with the media, our goal is just to try and encourage as many people as possible to get vaccinated. From a public health perspective, in some ways you could replace vaccination with wearing a seatbelt, with wearing a helmet if you ride a motorcycle, with not smoking cigarettes. These are things that healthcare providers are pretty used to counseling patients about one-on-one and speaking to groups in the community about the importance of these things. I think in this case, there was a time through last January or December for the 1A group and January for the rest of the population when we didn't have really effective means to prevent this illness. The thing that I think most healthcare providers are focusing on now is we have the tools to help you. And if we can answer patients' questions, like I said, one-on-one or through mediums like this, and really encourage people to get vaccinated, they will have the benefit of being protected. Their loved ones will be protected. Those who they work with will be protected. And that's really our goal. As we mentioned before, we think we've protected very high percentages of those most at risk for severe illness. But with these variants coming along that are more contagious, I think the case for those that are unvaccinated to get vaccinated just gets stronger each week, each month as we move forward with this pandemic.
And if they don't, are they supposed to wear masks for the rest of their lives? How long are they supposed to wear masks for?
Well, that's a good question. And the reality is we're not out of the phase of this virus and this outbreak that is one of the potential for widespread. So I think that there will come a time, I hope, that COVID-19 is no longer an illness that we feel a lot of people are at risk for being impacted by. But as long as a lot of people are at risk, we're going to advise those large groups of people to do what they need to do to protect themselves. It would be just irresponsible of us as physicians to not warn people about dangers or risk. The good news is, though, again, that there is a great option. There is great protection available through the vaccine. And we're really encouraging people to consider getting vaccinated.
I think the other way to think about that is to look at, once again, experience from around the world. If you look back in the 2000s with the SARS and the MERS pandemics and the use of masks in many Asian countries, especially during the winter time kind of viral season, it's continued on for now going on a couple of decades in some, almost a couple of decades in some cases. So if I've talked to one person, I've talked to 50 in the past month that have remarked on the fact that they didn't get the normal cold they got last winter. And when we look at our flu hospitalizations, and I haven't looked at the data in the last couple of weeks, but we were sitting at well under 150 total hospitalizations for influenza in the state last year, where we typically would be in the multiple thousands, 8,000 or 9,000 flu hospitalizations. So in terms of the general gestalt for mask wearing in the state of Ohio or around the country, I think we may see more masks voluntarily from people, even if they're vaccinated, moving into the November, December, January timeframe, just because they don't want to get the common cold. It's been really clear that masks work. I think that right now for airplanes and public transportation, masks are still required. They aren't guidance or optional or recommended. I have a feeling that people getting on airplanes for a pretty long period of time, even after this ends, may still wear some sort of a mask, just because how many times have people come home from vacation and gotten sick 3 days later? So I think the cultural aspects of mask wearing are really going to be something interesting to watch in terms of behaviors of those, not just in our state, but around the country moving out of this pandemic.
Thank you. We have just a few questions left, doctors, and the next one is from Alan Henry with NBC4.
Good morning, doctors. We've heard these teases of a second statewide vaccination incentive program, and obviously don't expect you to announce that this morning, but could you share any details, maybe when you say time is of the essence, maybe a timeline on that, or the importance of these programs with the context of the Delta variant and what you're seeing in the numbers?
Well, I really can't comment on any incentive programs, but what I appreciate your mentioning the time being of the essence. I think what Dr. Thomas and I and other physicians are looking at, and the message we want people to receive, is that this is really an ideal moment to go out and get vaccinated if you haven't yet, because we're heading into that fall time period when we know all respiratory viruses get more active, and we've got Delta on our doorstep here. It's already pushing towards being our dominant form of the virus. And if you get vaccinated, it takes a period of weeks before you're really well protected. So you've got to think ahead with this, and now is the time to get vaccinated.
Thank you. Our next question is from Max Philby with the Columbus Dispatch.
Afternoon, doctor. Good morning, doctors. Hope you're both doing well. There was a report out last week that said that if Ohio continues at its current pace, I think we wouldn't reach 70% vaccinated until May of 2022. So I'm just curious what your thoughts are on that and how we might really be able to speed that up. Thank you.
Well, I think that we're always interested in ways that we can convince more Ohioans to make the decision to get vaccinated because we really believe in the benefits of this vaccine. I am both encouraged by the numbers that Dr. Thomas and I have referenced thus far, but also concerned about the opportunity gap that still exists. The challenge is that right now, with what I've repeatedly described as a vaccine preventable illness, every illness we see, every hospitalization, every case of MIS-C, every long hauler, every death is one too many. It's tragic for us as doctors to see people get sick with something that we know is preventable. So that message, I think, is one that we're going to continue to share, and we're going to continue to encourage people to consider this as their best option.
I think the only thing I would add to what Bruce said, Max, would be when you look at that group from age 0 to 12, obviously that's a group that's not able to be vaccinated now. I really applaud the CDC, the FDA, and the vaccine manufacturers to make sure that they are, double checking all their numbers before moving lower than age 12 for vaccinations, given that younger people tend to tolerate the virus better. I think the benefit case for vaccination for those individuals is a little bit less than someone who's 80 years old. But I think that's one of the other, next steps that's going to come at some point later, potentially this calendar year, where we'll see a whole nother group of individuals become eligible for vaccination. And that's probably beyond the things that Bruce described. I think the next, big kind of ratcheting up step of those numbers. When you look at folks between 12 and 18 or 12 and 20, we're at 380,000 of those individuals that are vaccinated today based on between 12 and 19, 380,000 individuals vaccinated. And I think if we were to go from 6 to 12 and have a similar size group of individuals vaccinated, that's going to be a huge help to push us as a state overall to that 70% number. But as we described earlier, when you're looking at those over age 60 or over 70% already, and those over age 65 or over 80% vaccinated, I think those at most at risk have really been well protected by the effort so far.
Thank you. Our final question is from Jake Zuckerman with Ohio Capital Journal.
Good morning, doctors. I wanted to ask about the vaccination rate. We're about 7 months into the rollout, and we're still short of 49% vaccinated in Ohio, and it's slowing down every day pretty consistently. Should institutions like colleges and employers begin to impose vaccine mandates on their students and staff? Thank you.
Well, first, an encouraging note. While we, of course, want to see more vaccinations, when we put into perspective the very short period of time we've had available to get this vaccine out, and we're able to look and say, hey, for those 18 and older, we're approaching 60%, those older than 65 are above 80%. Overall, we're approaching 50%. That's actually pretty remarkable. In terms of further incentives for vaccination, I really can't comment on what employers will be doing or should be doing. I will note that I've seen media reports of some employers feeling it is a critical necessity for their workforce to be vaccinated. But that's not something that as a Department of Health we're mandating or pushing.
And if I may follow up here, when ODH employees come back to the office, will they be mandated to be vaccinated, or will you leave it to them to decide?
Well, again, we are not mandating that anyone be vaccinated. No one will be compelled by the Department of Health to be vaccinated. So with our own workforce, we're following the CDC guidance, and we are strongly encouraging vaccination. Those who are vaccinated do not need to wear a mask in most settings, while those who are unvaccinated, we are asking to mask and maintain distance. Again, in alignment with CDC guidance. Exceptions to that, of course, would be those of our workforce who are in healthcare settings. And there's a different situation because they're dealing with vulnerable patients. And we follow the CDC guidance there as well.
Thank you.
Thank you very much, doctors. We appreciate your time today. If you'd like to share any closing remarks, feel free. Otherwise, we can go ahead and close this event. Thank you again.
Thank you.
The only comment I would say is thank you to all those in the media that are here and doing their best to try and combat that disinformation that we discussed earlier. So thank you all for everything you're doing to try and get the message out.
Yes, yes, indeed.